Anyone from babies to the elderly can have a stroke. Every year, about 70,000 Americans under the age of 45 suffer from one. Kim Clark from Memphis examines the trend and what may be behind it.
Coming on in.
Loretta Plummer works in the emergency room at St. Francis Hospital in East Memphis. She's been a nurse for 8 years. What is it about being a nurse that you love so much?
I love being a nurse just to have compassion for people, especially as an emergency room nurse. People come in on their worst days.
One of her worst days came about 5 years ago, 6 months after her son was born. Loretta was getting ready for work when she realized something was very wrong.
And then I realized my entire left side went down. I had the facial drooping. I had my slurred speech. So I sat there and I was like, okay, is this really happening?
Loretta knew she was having a stroke. She immediately called 911. Paramedics came and took her to the hospital.
I was in my mid-30s and, you never think about having a stroke or anything really that traumatic happen to you, especially if you're living healthy.
Loretta is part of a closely watched growing trend. Data compiled by the Centers for Disease Control and Prevention shows a nearly 15% rise over a 10-year period in the number of people between 18 and 44 who've suffered strokes. Tennessee had one of the most significant increases, almost 21%.
Everyone always thinks like, oh, my grandmother had it, or my grandfather had it, my great-grandma had it. But now it is starting to kind of trickle down into these younger patients.
What's behind the trend? Physicians say unhealthy lifestyle choices, genetic conditions, stress, drug use, and infrequent visits to the doctor. Becky Mitchell is Loretta's boss and director of the St. Francis Emergency Department.
A lot of times there's a delay in care because they may wake up at home and think, this is going to go away, rather than, having that knowledge and education to know that these are signs that you immediately need to seek treatment for. Call 911.
Early recognition and treatment can significantly improve your chances of recovering from a stroke. Call or see a doctor if you have sudden weakness or numbness, especially on one side of your body, difficulty speaking or understanding, vision problems, dizziness or loss of balance, a severe headache.
Time is brain tissue, so in a stroke, it's very important that you seek help immediately.
As Loretta knows, with early treatment, there is life after stroke.
What I loved is she stopped what she was doing and called 911. Thank goodness, because a lot of people would just push that off. Even a lot of healthcare people would push that off.
Because she's in the healthcare, she knew something was not right. But when you're that young, you just think, you don't think about a stroke. You think of something else like, oh man, I have a headache or something else is going on. Let me just see how I feel a little bit later on and all that.
Somebody in the healthcare field would quickly dismiss it as Bell's palsy. Okay, maybe I'm having that just moment for...
But when the whole side goes, that's
that's pretty extreme. The face is one thing, but then when you lose the side...
And especially with a stroke, if you see people who've had strokes, if you think about what's really happening, it's a disruption of the blood flow. I mean, it's excruciating pain. So for her just to go silent like that, but no pain, that's unusual.
Yeah.
I thought it was interesting they gave the reasons like lifestyle, don't see your doctor enough, but they didn't say anything about environment. And things that could be in your home, things that can be near your home, things you're being exposed to. You have to wonder.
Why are we getting this increased incidence of stroke in people who are 45 years of age and younger? It is definitely a lifestyle. It's a combination. Lifestyle, the toxins, the environment.
Absolutely.
And it's really chronic inflammation because that causes us to decrease blood flow everywhere and you just start blocking off things.
Yeah.
So it's there. Everything is kind of all working together. The body's kind of all working together. It's getting hit on multiple different levels to where it just can't function anymore.
When she said time is tissue,
The brain.
it startled me. And I've always known, like, if you have an issue, like you think you're having a stroke or somebody has to get them in the hospital right away or know which hospital is like the stroke specialty hospital. But that resonated with me.
You cannot have a delay in too much time of oxygen to the brain.
Yeah.
Right? You cannot recover from that.
Great discussion, ladies.